all saying tools. Okay, they're not tools, they're instruments. Okay, we're going to get into the instruments that we use for them. Okay, so this one right here is a plastic instrument. It's called a plastic instrument, and we can pass it around if you like.
Is that because it goes hand in hand with a composite?
I mean, you can think of it that way. Yes, so like it has a flatter surface, so it's used to kind of like, usually like on like the facials of the anterior teeth, it kind of helps smooth out and contour those places for composite restoration. You wouldn't use this during an amalgam procedure. There is always a doctor that does something that's not like the normal, and they may be using this somehow during something that's not normally used, but for what we're learning here, this is a composite instrument, okay? It's called a plastic. Would you like to hold it, or you feel?
Yeah.
Okay. I'll take it there. Okay. So that's a plastic instrument. Okay, so this right here, there's two different styles of this. They're called spoon excavators. Okay, so it has like a little, if you look at the edge of them, there's a large one and a small one, okay? So they have like a little rounded disc on them, but they also have like a scoop. Like the way the disc is set, it's like this. It's a little bit rounded. Okay, so doctors will use this to kind of remove like, so say they're like drilling out decay in a tooth and it starts to get really close to the nerve. Sometimes doctors will use this to kind of just scrape just a little bit more to get the rest of the decay out, because you know they're trying to not have to go into the nerve of the tooth, because what happens if you get to the nerve of the tooth?
It hurts.
You kill
No.
the tooth.
The tooth is numb. What happens if you get to the nerve of the tooth?
You have to do root canal.
You have to do a root canal. So we try to avoid that. And so they're drilling with their burrs, and then they get, okay, they can kind of see the shadow of the pulp chamber showing, and so they're like, let me just see if I can get the rest of the decay out with just the spoon excavator. A large and a small spoon excavator, okay? You can look at those a little closer. Okay, so then this is a die-cal instrument, okay? So it has like a little ball on the tip of it. There's two different styles, and you'll learn your doctor and know what style they want. Or this one, I think, is for like if you're like deeper down into the canals of the teeth. But again, your doctor will tell you their preference. But this is used for like application of like dental materials. Like if you're adding I can't think of the word I'm trying to say. If you're trying to like, so say again, if you're at the nerve of the tooth and you're like really close, sometimes you need to add, not a glass, is it a glass ionomer? Or what is it, like if you're trying to cover up the nerve of the tooth?
It's a base.
Yeah, so you're adding like a base, so like it's like a medicated type of material, and you guys will learn more about the materials.
That's with fluoride in it.
Yeah, so glass ionomers, so they are glass ionomer base. You guys know what glass ionomers are? Okay, you'll learn more about them. What is a glass ionomer?
It's like, Dr. Cordova used it in a filling. He said that it remineralizes the teeth, and I don't remember why he used it.
Yeah,
He just says,
good.
like, because he was drilling, and he says, like, it remineralizes the teeth.
So it releases fluoride.
Mm-hmm.
That's like the term you would like to use. It releases fluoride, which remineralizes the tooth. So yes, you're right. Again, you would add these. You would use this. You would mix it with the spatula, or if it requires that. But the material may require you to mix something, and then you would scoop a little bit onto your die-cal instrument, and then you'd hand it to the doctor to add into wherever they need it to go, like to cover up certain spots. And a lot of times those bases help to insulate the tooth as well, so that the tooth isn't sensitive for the patient. Because sometimes when you get really close to the nerve and you're drilling in there, after you place the filling in there, the tooth can be really sensitive to temperature. So those bases help to protect the tooth so they don't feel so much sensitivity. Okay?
What was the name of that tool again?
This one? Oh, I'm sorry, I didn't hand it on. This is a die-cal instrument. Die-cal. Die-cal. These are all labeled online too for them, right?
Yeah,
Okay.
I'll show them in just a second.
Yeah.
The
So let's-
die-cal is a name of a product,
Yep.
and because that product is so common, they just named the instrument after it.
Right.
Die-cal instrument.
Yep, die-cal is a base that's used. Duralon and die-cal is like the name. I think that one's a mixture, right? Duralon, die-cal. You mix it together. Sorry, I'm not in restorative. Sometimes need a refresher on certain things. Okay, these are condensers, okay? These are commonly used with amalgam. They should only be used with amalgam. Again, I have had dentists use these on composites, but these are used for amalgam, okay? There's a large and a small condenser. Now both ends, this one is like the biggest, and then there's one that's a little bit smaller than this one, the biggest, but it's still technically smaller than this. So again, like you were asking, yes, there are duplicates, but they still have different sizes based on like what you need for the tooth or what you're using it for. Sometimes they'll start out with the bigger one if they have like a wider surface area, and then they'll kind of work their way to the smaller settings depending on how much they're trying to close up the tooth, okay? But these are condensers, okay? And if it's a large condenser, then you'll see the biggest side, and then small condenser, it's just a little bit smaller. Okay. Okay, so again, those are for amalgams, okay, the metal alloy. And then you have your discoid and cleoid, okay? This is the discoid end. If you look at it, it looks like a disc. Same on this one. This is a smaller version of this, okay? It has a disc on the end, okay? And then this is the cleoid end, okay? It has like more of a pointed, almost looks like a leaf, I guess. Okay, and you'll get to see these. Again, these are usually normally for amalgams. Excuse me. And this is once you get to the top of the amalgam, like you're at the occlusal surface of the tooth, you'll start to use these instruments to shape it, to give it anatomy, to make it look like a tooth again. So it's not just a box of filling material. So you start to use these instruments to help shape the tooth and carve out some of the excess amalgam. Okay?
What's the name?
Discoid, cleoid.
Okay,
But you would
so
just call it, yeah, what were you gonna ask?
each side, we have to name each side of it?
Do they? Yeah, so you need to name each side, but it's called a discoid cleoid if you just
Oh,
say the whole name.
If you look at it, one's a circle.
Yeah,
and
and that's
then
the disc
cleoid
side.
is like a spear type shape. That's the cleoid
Mhm.
side.
Yeah, you can use whatever it takes for you to remember it. It can be something not even related to dentistry. So discoid, cleoid, but the instrument itself is called a discoid cleoid, okay? You can look at those. Okay, and then we have a half Hollenbeck. And this one looks like a hockey stick to me. And again, this is used for amalgams. Yes, they're used for amalgams. Another instrument that shapes the tooth. You can kind of carve out different parts of anatomy on it. This can also be used for several other things, and we'll show you once you guys move on in the program. Like when you're placing rubber dams, sometimes you can use it to kind of scoop it and get teeth where you need it to go. Not teeth, but get the rubber dam to go where you need it to go and stuff like that. But yeah, so this is a half Hollenbeck. Like I said, I think of it like a hockey stick. And like, I don't know, I feel like is there a hockey player name?
Holland.
Their last name is Hollenbeck?
Probably Holland.
Anyway, that's how I remember this one. It makes me think of a hockey player, and it looks like a hockey stick. So this is a half Hollenbeck, okay? And then this one is what we call a cord packer.
Cord.
This is the cord packer, yeah? That's what they're calling that?
That's a cord packer.
Yeah. So this is oh dang, I didn't even see these were piling up over here. Okay. So this is a cord packer. So basically, when you're doing, do you guys know like a class 5? So like, huh?
Class 5 occlusion.
No, not class 5. So like a class 5 filling. So like class 5 fillings are like ones that are right along the gum line. So the person gets decay right at the gums. And so in those cases, the doctor sometimes likes to have like a piece of cord packed along the gums. Obviously the patient is numb for that. But to get it underneath the gum line, and again, you guys will learn about this, you'll need to use this to push it underneath the gums, okay? And so this is what you would use. It's called a cord packer. And that pushes the gums out of the way, so that way when you put the filling in on the tooth, it makes it so it's flush against the tooth and not like a big chunk extra overhanging. Mm-hmm.
Are those also used during deep cleanings?
No, we don't use these. Mm-mm. But that's a cord packer, okay?
They all look so similar.
Do they?
Kind of. I mean, you've been working in that for so long, so they all probably look
Yeah.
extremely different too.
I mean, if you look at the edge on this one, the rounded part, it's kind of ridged. It has ridges.
Oh, it does.
So if you, and you can feel it, this is not being used on a patient, so just feel it. And let everybody else feel that too. So that's a cord packer, okay?
Oh, she's sharp.
Okay, so then this one, this is where we start to get more into like the composite instruments. All those ones that I just showed you, like the discoid, cleoid, the condensers, the spoon excavator is pretty, you use that in any, yeah, because what is it for? Do you guys remember what I said? The spoon excavator.
To get out the excess.
Yeah, like if there's extra decay or something like that, you'll use that. The doctors will use that, okay?
Or like, it feels like
Oh, I
little
see,
teeth.
Yeah, you feel it, those little ridges, yeah.
It's definitely subtle though.
Mm-hmm.
Could you use
We'll go for like
The half.
4 more minutes and then we're gonna let y'all go, probably.
the half one as a cord filler?
The half Holland back?
Yeah. Or
It
not?
does get used, I mean, it does get used, but there is an instrument dedicated for that, for packing cord.
How does like the little teeth on the tips?
I don't know if that, I think it might help just like with, like something on the
Like
cord, like,
gripping the cord?
yeah, for the cord or something, but I don't know if it really,
Yeah.
like I said, I have seen people use the half Holland back, but the thing is, you can do a lot of damage with these instruments. If you're pushing too hard, you can like, you know, the PDL, the ligaments that hold the teeth, you can break those. So you need to be careful when you're using these, and we'll talk about that more as you guys get to start using it, because you will be the one packing cord. Okay, so then there's this plastic instrument. Now this has a rounded end. It's kind of like a condenser, but it's more rounded, and this is for composites. So when you're packing in composite, and then this is the plastic end to, again, do similarly as the full plastic instrument. Wait, these are both plastics, right? There's two plastics?
So the one, that's the plastic and that's the Woodson.
Woodson, I'm sorry.
Yeah, the
Wait,
one with the
this is
black on the
Woodson.
end is the Woodson.
I'm sorry.
It looks like and it's got a condenser on the other end.
Yeah, sorry.
That's the Woodson. No.
Okay, so this is the Woodson, okay? The Woodson. And so it has a condenser on the end and a plastic other half, but it's meant for composites, but it's called a Woodson. Okay? If you look at the condenser end, it's more rounded. It's not as flat and like boxy as the amalgam condenser. It's more rounded, okay?
You said it's plastic?
It's called it's
It's
like a
called a
plastic
plastic.
instrument,
Okay,
yeah.
okay.
But so that flat end is the plastic end, but just call it a Woodson.
Okay.
A Woodson.
Woodson.
Mm-hmm. Okay, so this is a ball burnisher. Okay, again, this is for composites, and it's to, you know, condense the composite into the cavity. Okay, the reason why I think a lot of the ends are more rounded with composite is because with composite instruments is because it's easy to create air bubbles in the composite when you're doing like this to push it down. So the technique is a little bit different. Like it's more of a back and forth type of motion to make it more smooth, so that you don't get those air bubbles in the composites when they're placed by the doctor. Okay, but this ball burnisher has a ball end and then a football end. It's pretty self-explanatory. It kind of looks slightly like a half of a football, but this end is called a football end. Okay.
For the ball burnisher,
Mhm.
would that be like more for the smoothing out of the filling? Cause like you're burnishing in a way?
In some sense, yeah, you're smoothing it, but like you can be using it to pack it in as well.
Okay.
It's helping to pack it, push it into the grooves that it needs to go in.
Okay.
Mm-hmm. Does that make sense?
No, that makes sense.
When you start seeing them, it'll make sense too. And you'll just need to know the names of these because your doctor will call them out to you. And then at some point, like Dr. Cook was telling us, you want to just know your doctor so well that he doesn't need to say it, he or she doesn't need to tell you. You just know, okay, he's going to want the plastic. He's going to want the discoid cleoid. Oh, he's going to want this. Or, you need to know like what your doctor wants. But for the sake of, the beginning, you want to know the name so that way when he's like condenser, you're not like, oh, which one is that? You don't want to be trying to like scramble to figure out which one it is. You need to know these.
Yeah.
Okay, so this is like a hygiene, this is pretty much like a hygiene instrument, but on the restorative kit, it's called IPC, interproximal carver. Okay, so this is technically probably should have been up here. You use this more with amalgams to kind of like polish off the excess in between the teeth. So if a cavity goes MO, you guys know surfaces, yes? If it goes that way and they pack in the amalgam, when they remove all the parts, you're gonna wanna like go in between to kind of smooth it out to make sure there's no excess. These are pretty sharp, so just be careful touching the ends. This is an IPC, interproximal carver. Okay, these are your cotton pliers. Okay, so I don't know how you teach these. Okay, so one is supposed to be used for like handing the doctor like smaller things. So like if you need to hand them like a wedge, you would put it in between a cotton plier, hold it down here where the wedge is, and hand it to the doctor like this. Okay.
You touch the wedge?
Yeah, well, you're gonna be gloved. It's all for this patient, so it's fine. Yeah. So.
Go ahead. I was just gonna say typically, especially in neighbor care, there's two. There's one for clean and on.
That's what I was gonna ask. Okay, yeah.
Right.
Okay, cool. So yes, and then the other one, I wasn't sure if we were gonna teach it that way.
Yeah.
The other one, when you open up your kit, you wanna set this one aside. It's gonna be your clean hands. Okay, you kind of have it in a place that's reachable for you, so that way if your doctor needs something, you can do this and just grab it, out of here or somewhere like that. So then you're not having to necessarily deglove. Okay. But you need to make sure they're separate because one is going to be going in the patient's mouth and one is for you to grab something extra that you may need off the shelf where there's other clean things. Does that make sense?
Are they both called cotton pliers?
They're both cotton pliers. They're just cotton pliers. That's all they are.
So say like one would be for taking the gauze out of the mouth.
No, you would just grab gauze out of the mouth for
Okay.
with your hands. I mean, yeah, if it's kind of like in a spot where you can't reach it, I guess you could use these.
Yeah.
Use your dirty set for that, whatever, for the patient's mouth. But like, this is more to hand them, like I said, like a wedge or anything like that.
Okay.
Like the smaller things, okay? Okay, so cotton pliers, you don't need these, you got it, cotton pliers. Okay. This is, you guys know what this one is?
I know.
Oh, the X-ray bite.
Say it again?
Bite block.
Bite block. Yes. So this isn't used for x-rays. This is just to help keep the patient's mouth propped open for treatment. It goes in this way.
In case so they don't get tired with their mouth.
It does help to rest the jaw, but some patients actually don't like it. But yeah, I feel like in pediatrics, this is used like pretty much all the time, especially if you're giving an injection because, the kid, you don't want them to close down. So yeah, have you guys ever had this used on you? Yeah, I feel like as adults, they don't use it as often. I like them, but, so yeah, this is just to help prop the patient's mouth open.
There's a lady at
Bite
my
block.
observation, her jaw kept like popping,
Mm-hmm.
getting out of dislocated.
Oh,
They had to use that.
yeah. So yeah, it does help to rest the jaw, but some patients feel like it's straining their jaw. I think because they're like squeezing it, so then it's more tension. They don't know how to just relax on it. So if you ever use it, I always just say, okay, just relax your teeth on this, and hopefully it helps. But usually as with adults, you use it like as needed, or if your doctor really wants it all the time. So then, okay, we talked about the spatula. You're going to use this to mix different materials. You guys will learn more about the different materials you'll get to mix later. And then you have scissors in here. They're just called scissors. I don't think there's anything special. You guys don't have a special name. Yeah, they're just scissors. You can use them. These are used to like cut the rubber dam off. So again, you guys will learn how to do that, but there's like a little hook right here. and you use that to go underneath the little holes to cut the rubber dam. Then you have this is articulating forceps, okay? You're gonna put a piece of paper in here, and then at the end of a procedure, the doctor checks the bite, so that, why? Why do you think the doctor checks the bite?
If it's even.
Even why? Like,
If it's
give me
not,
more.
it'll, so you can shoot properly.
You could, yeah,
If
you
it's
can
not
shoot
even,
properly.
Your bite will be off center.
Yeah, all those things are correct, yes. You don't want the patient feeling like it's off. They will feel it. Like it can be like even sometimes like the smallest little grain of salt of it being off, and it's uncomfortable. Like it'll just be like, ow, if you bite on it wrong and stuff like that. So you wanna check the bite. The doctor will help you do that. You don't, the doctor is basically doing it, but you just need to hand it to them with the paper ready.
That's the little black paper strips, right?
They're blue. Well, usually I see them as blue, but I've seen red ones, and they're usually like a color that, you know, is bright
Like
and
leaves
stands
on
out.
the
Yeah,
tooth.
that it'll stain the tooth a little bit, but it wipes right off. Okay,
What was it called again?
this is articulating forceps. So it just pinches here, and you put the paper in there, and the rest sticks out, and then the patient bites on it. You want to hold these, or are you good? Articulating forceps. And then this is a burr block. You put all the burrs on there, what the doctor needs. It's magnetized, so the burrs will just snap right in there. This is for your bond material for when you're doing composites. Okay, you snap it, and there's like a little, the bond sits in there, and you snap the lid, and then you take a micro brush
So
to
like
dip a little bit of the
suction
bond.
cup to adhere to the table.
No, it doesn't suction.
Oh.
It's just a little doodad. Okay, then this is your forceps and your framework for what?
Rubber dam.
Rubber dam. You guys will learn this soon, okay? And we'll show you all how to use it. But yeah, forceps. So this is the forceps. This is the frame. Okay, for rubber dam. Forceps and frame for rubber dam. Any questions? Okay. After lunch, you guys, if there's downtime, I would encourage you to come check over here and just look at it. You know, maybe quiz each other on little things. Yeah, just try to really get familiar with it because it's gonna come up again, and yeah, you need to know it really bad. Okay. All right.